Dr. Ted O'Connell here again, talking on the idea of high flow oxygen. So somebody with a significant COVID infection is going, and respiratory issues, is going to come in one of two ways, either feeling pretty asymptomatic from a respiratory standpoint, but having very low oxygen levels, or they're going to come in feeling really short of breath. It's almost like a fish out of water description that these patients provide. And as I said in the last video, if you can get them onto high flow oxygen, you can often get them through that window period. And it's urgent because their oxygen levels are dramatically low. That may have some real long-term effects on cells in the body and organ function, and may even be part of what we're seeing as kind of this inflammatory response. And so the thinking is get those oxygen levels up. So with your oxygen concentrator, you need to have the oxygen be able to be concentrated very significantly. And a good oxygen concentrator will be able to go between 21%, which is room air, and close to 100%, or even hitting 100%. And you need the flow of oxygen to be very significant. And as I said before, 10 to 15 liters on one end and as high as 60 liters in an industrial machine in order to give them that high flow rate. Because if you're breathing really fast, you have a lot of what we call minute ventilation. It's a lot of airflow flowing through the lungs, and you need to provide significant flow in order for the patient to be able to oxygenate their body adequately. So a good oxygen concentrator is going to be able to dial up to a high oxygen level and have as high a flow rate as possible.